Around 41,000 people in North Carolina are living with HIV. There are roughly 1,600 new cases per year.
Erase the stigma that exists around HIV. And I think it's both stigma around people living with HIV and also the LGBTQ community, right? Both of those communities are still so marginalized, so much judgment and stigma is placed on them that it really impacts folks' self-worth and their ability to get into care.
People living with HIV and AIDS cite stigma from family, their community, and medical professionals as a major barrier to pursuing care.
So we operate a food pantry that receives no funding, and it's grown from 2 years ago we were giving out 6 tons of food a year. Last year we remodeled it after our clients told us what they like, so they can actually come get a shopping cart, go down aisles, and pick their own food out. And now, so then we went from 6 after the remodel, we were doing 12. This year so far we're up to 30 tons of food that we give out.
People with HIV have a 30% greater caloric intake than others because of their body's need to process the virus.
So I think one of the things we know about HIV is that many folks dealing with HIV need a lot of the same support services that individuals dealing with other chronic diseases do. Stable housing is really, really important for folks living with HIV. You know, housing really is health care. Folks who are living with HIV often have their medication mailed to them, so if they have unstable housing or people living in their home who aren't supportive or who are stigmatizing, they're less likely to have access to their medication or adhere to housing. Or adhere to their medication, excuse me.
More than 60,000 households nationwide receive HOPWA funding. Around 20% of the recipients are under age 18.